I've known Nancy for over 20 years. She's had bad knees for a long time.
I had severe arthritis in both knees. It was very, very difficult, and it had gotten to the point where I really couldn't function normally anymore.
What we do is we make special cuts on both the thigh bone and on the tibial side. We then cement the femoral component and the tibial component, and then we put a plastic liner in between to recreate the joint.
I was so much better. By 3 weeks, I made my appointment for my next surgery.
And we did for June, but of course what happened, COVID got in the way.
I think we knew only 2 weeks before that we would be able to go because I was a very early surgery back in the hospital.
Coming out of the period of time in COVID where we could not do any elective procedures, we had to have things in place to make sure that the patient's experience, number one, was safe. It was implemented system-wide.
When I went to the hospital from everything from pre-op, I was extremely comfortable. They met you outside, they staggered when you could go in, they provided their own mask, so it felt very comfortable. I think the biggest change for me is just in day-to-day life. Things aren't difficult anymore. I just regret that I didn't listen 2 years earlier when Dr. Healy suggested that I do the surgery. I should have done it much sooner because it's changed my life.